Hi, my name is Chelsea Binder and I'm a student nurse from Cedar Crest College. Today I will be discussing the effects of music therapy on anxiety of patients with breast cancer after a radical mastectomy. The problem being that breast cancer and the treatment of it can cause severe psychological disorders, with anxiety being the most common. The significance of the problem related to nursing practice. Breast cancer is prevalent throughout the entire world and is developing at a rapid pace. 1 in every 8 women are likely to suffer from breast cancer, and it is one of the leading causes of cancer death in women between the ages of 35 and 50. Female breast cancer, especially those who have a radical mastectomy, are confronted with the indispensable stresses during their lifetime. Anxiety is the most prevalent psychological symptom, with a rate being between 21 and 29% in other countries and between 50 and 86.4% in China. It can also cause fatigue, sleeping difficulties, changes in weight, and other adverse effects. This can make the treatment and recovery be hindered in these patients. The aim of the study was to examine the effects of music therapy on state anxiety in female breast cancer patients following radical mastectomies in a Chinese setting. There's 2 hypotheses. The first being patients in experimental group will have a reduction score of state anxiety in comparison with patients in the control group after music therapy. The second being the treatment effect changes with follow-up time. For example, there is an interaction effect between the treatment group and follow-up time. There are 2 variables, the independent and dependent. The independent variable is music therapy, and the dependent variable is the anxiety level of female patients post-radical mastectomies. The theoretical framework used is the Lydia E. Hall's CORE, CARE, and CURE model. CORE stands for the patient, CARE stands for the body, and CURE stands for the nursing behavior. The female breast cancer patients following radical mastectomies were in the 2nd stage of illness. Anxiety caused by the disease itself and related treatments left patients with many adverse effects, which influenced the effects of the treatment. Music therapy following radical mastectomies to reduce anxiety, patients could control their own feelings, motives, goals, and ultimately exert their self-potentials to the greatest extent. A description of the sample is that clinical trial was conducted in the Oncology Center of a general hospital in Shan, China. The target population are patients with breast cancer who were admitted to the hospital. The convenient sample was breast cancer patients that were recruited according to the following inclusion criteria, which includes being a female, aged 25 to 65 years old, and diagnosed with the pathological diagnosis of breast cancer requiring a radical mastectomy, which includes both the modified and extensive. Patients excluded if they were allergic to sound or had the voice sensitivity of epilepsy or did not prefer music listening. There were 120 female breast cancer patients recruited, and they were randomly assigned 60 to the experimental and 60 to the control group. The data were collected by using a standardized demographical data questionnaire and the State Anxiety Inventory, or SAI. Demographical data questionnaire includes a total of 15 items: age, occupation, educational level, residence, monthly income, marital status, age of first suffering from breast cancer. Chinese version of the SAI was used to evaluate anxiety. The SAI is one of the most widely used to evaluate anxiety, and it consists of a 20-item scale using a 4-point Likert format. Possible scores range from 20 to 80, 20 being the least amount of anxiety and 80 being the highest. Both groups completed the demographical data questionnaire and SAI pre-test. The primary endpoint was the scores of the state anxiety at follow-up visits. The intervention used for the experimental group, the patients were given an introduction of the music and type of music stored in the music media library, which had been copied and downloaded to an MP3 player for them. These patients selected their own music after the music was downloaded, controlled the volume, and did listen through headphones. The music therapy was 2 times a day, 30-minute sessions. First in the morning between 6 a.m. and 8 a.m., second in the evening between 9 p.m. and 11 p.m. The control group intervention, the patients in the control group took part in the pre and post tests. There were 3 post tests. They were not offered any information about the music therapy to control any bias that would occur, and only received the routine nursing care, which includes the perioperative care, and the chemotherapy nursing care. The music media library intervention was established by the researchers and experts based on the effects of different types and modes of music in treatments, and according to the characteristics, pentameter therapy principle, and different tonalities. The ethical considerations in this study, it was reviewed and approved by the appropriate Human Research Ethics Committee. All participants received an explanation of the study before participating and gave written informed consent before voluntary participation. There was a statistically significant between group difference in the scores of state anxiety than those in the control group at each of the 3 post tests. State anxiety of the experimental group was improved distinctly after music therapy for the postoperative hospital stay and the following 2 chemotherapy periods. It suggests that it is beneficial to give music therapy as an adjuvant therapy for female breast cancer patients undergoing surgery and chemotherapy so that the issue of anxiety can be addressed. There were a few limitations to the study, which included that the data were self-reported and could have been influenced by numerous factors such as defensiveness, misrepresentation, personal emotion, and other attitudes. Collected only quantitative data from the patients. Subjective experiences for effects of music therapy need further study. There's no physiological variable used, so therefore the effects of music therapy on the physical aspects of the patient need to be further assessed. The control group only received the routine nursing care, and lastly, the patients with the extensive radical mastectomies only accounted for a small portion of the population of patients used, therefore it needs further explanation. And lastly, the implications for practice are music therapy can be used as an alternative way of improving anxiety in female breast cancer patients following radical mastectomies. It will benefit a large number of patients in China if it is generalized in clinical practice and increase their life satisfaction and well-being. The last implication being music therapy under the instructions of the core care and cure model could be used as part of the nursing care practice. And there's the reference. Thank you so much.